Bismillahirrahmanirrahim. The next topic of our discussion is iron deficiency anemia. So iron deficiency anemia basically occurs due to deficiency of iron in the body. And since iron is a central constituent of hemoglobin, the deficiency of iron leads to inadequate synthesis of hemoglobin. So once the hemoglobin levels are below 13 due to deficiency of the iron, it is known as iron deficiency anemia. This particular anemia is more common in adolescent girls and in women of childbearing age. Iron deficiency anemia is rather less prevalent in the developed countries. We will not indulge into the details of iron metabolism, but it is important to know the daily requirements of the iron, which is 7 to 10 milligrams per day for men and almost 7 to 20 milligrams per day for women. Coming on towards the etiology, the deficiency of iron can arise due to multiple factors. The first of all, the most important one is the dietary deficiency of iron. On certain occasions, if the diet is not deficient in the iron, there could be impaired iron absorption from gastrointestinal tract, or there could be an increased iron requirement, or in old ages, chronic blood loss can also result in iron deficiency. The dietary deficiency is more common in vegans, which occurs due to lack of heme iron. Heme iron is primarily present in the meat and poultry products. The other causes of dietary deficiency include malnutrition, which is more prevalent in the underdeveloped and developing countries. The second reason is impaired iron absorption. Impaired iron absorption could be due to gastrointestinal disorders such as topical sprue, chronic diarrhea, and moreover in gastrectomy patients. There are certain foods that also affect the absorption of iron from gastrointestinal tract. Some of these foods increase the iron absorption, while there are some other diets that decrease the iron absorption. The factors that increase the iron absorption include presence of vitamin C and citric acid in the foods, whereas some other nutrient elements that decrease the iron absorption include phosphates, carbonates in the diet, and moreover a specific chemical known as tannin, which is present in tea. Carbonates are most commonly present in the carbonated drinks, so the consumption of iron-rich food in the presence of either tannin, carbonate, or phosphates can result in decreased iron absorption. Moreover, there could be increased iron requirements, such as in growing children, in pregnant women, and also in premenopausal. In the absence of all the above elements, in certain cases there is chronic blood loss of which the patient is mostly unaware. The chronic blood loss can result in increased production of red blood cells and excessive utilization of body reserves of iron, and ultimately the body runs low of its iron reserves. So the causes of chronic blood loss include menorrhagia, which means excessive menstrual bleeding, and gastrointestinal tract bleeding. The gastrointestinal bleeding could occur due to presence of a peptic ulcer, or in certain cases in colorectal adenocarcinoma. So all of these factors ultimately lead to deficiency of iron in the body, which results in iron deficiency anemia. So once there is the deficiency of iron in the body, there is less iron available for the synthesis of hemoglobin. So as a result, its synthesis decreases in the red blood cells. In the iron deficiency anemia, the red blood cells become pale and small, which directly translates into hypochromic microcytic anemia. Hypochromic means pale or less colored, and microcytic means small cells. So coming on towards the morphology, the peripheral blood smear reveals small and pale red blood cells with an enlarged zone of pallor. So as you can see in this picture, this here is a normal red blood cells which is acquired from the transfused blood, and this here is a patient's own red blood cell. You can see the difference between these two. This normal red blood cell is reddish in color and it has a small zone of pallor in the center, whereas in this case the red blood cell is pale and the central zone of pallor is rather enlarged. and the hemoglobin is only present in the periphery, forming a peripheral rim of hemoglobin. The blood smear also reveals poikilocytosis. Poikilocytosis means increase in the number of red blood cells of variable shapes. As you can see here, these are the elongated red blood cells, which are also known as pencil cells or cigar cells. The morphology of the bone marrow reveals increase in erythroid progenitor stem cells, which is basically occurring due to increase in erythropoietin. Erythropoietin, as you may recall, is a hormone produced by the kidney that increases the red blood cells synthesis. The bone marrow aspirate also reveals that there is loss of iron from the bone marrow macrophages. These macrophages in the bone marrow are usually laden with iron, but in case of iron deficiency anemia, there is loss of iron from these macrophages. This is particularly seen on Prussian blue stain. So coming on towards the clinical features, as it is well established that anemia results in decreased hemoglobin, so there is an inability of blood to efficiently provide oxygen to the tissues. This ultimately results in hypoxia. So the hypoxia of skin results in pallor, and hypoxia of muscles result in weakness and fatigue. The hypoxia is detected by the tissues, and the heart tries to compensate this hypoxia by increasing its heart rate so that it can efficiently provide blood to each and every tissue. So this ultimately results in palpitations or tachycardia, and there is also dyspnea or shortness of breath. So hypoperfusion or hypoxia of brain results in lightheadedness and often headaches. It can also result in blurred vision, and the patient can also present with faintness or loss of consciousness. One particular feature about iron deficiency anemia is that it also presents with pica. Pica is the appetite for non-food objects such as sand. Hypoperfusion of heart can result in tachycardia and often in angina. Hypoperfusion of kidneys results in secretion of excessive erythropoietin, which increases the red blood cells production. But it can also result in derangement of renal function tests or RFTs. Plummer-Vinson syndrome is a classic triad of iron deficiency anemia, formation of esophageal webs, and atrophic glossitis. The physical examination might also reveal koilonychia. Koilonychia means the loss of normal curvature of the nail bed, which in normal situations is convex. But in this case, you can see there is an indentation of the nail bed, and there is formation of a concavity, which is known as koilonychia. The patient might also present with alopecia, and alopecia means irregular loss of hair from the body. The first step towards diagnosis is establishing that there is anemia. So anemia is characterized by decreased hemoglobin and hematocrit, and there is a decreased mean corpuscular volume as well. The peripheral smear reveals that the red blood cells are pale and small. So far it is established that the patient is suffering from anemia. The next step is to establish that it is iron deficiency anemia, because hypochromic microcytic anemia is not purely a feature of iron deficiency anemia. Other reasons that result in hypochromic microcytic anemia include thalassemia and chronic lead poisoning. So the next step is to establish iron deficiency. The ferritin levels are decreased, and there is decreased plasma iron. The total iron binding capacity is increased along with the transferrin levels. So the ferritin levels, plasma iron, and total iron binding capacity reveals that there is iron deficiency anemia. The next step in the diagnosis is to establish the cause of iron deficiency, which could be either dietary deficiency, or the iron deficiency could be due to an underlying disease. So it is always important to evaluate the patient for the underlying disorder. Gastrointestinal endoscopy is done to rule out a chronically bleeding peptic ulcer or any other gastrointestinal anomaly. Ultrasound abdomen and pelvis is also done and stool test for occult blood is also done for screening of colorectal adenocarcinoma. The treatment of iron deficiency anemia is definitely to treat the cause and replenish the iron reserves in the body, which is done by using iron supplements such as ferrous sulfate. In severe cases of anemia, IV iron is also given, and the patient might also need blood transfusion. So this brings us to the end of discussion about iron deficiency anemia. If you have any questions, do let us know in the comment section.